Assalamu alaikum. We are here to have a discussion about diabetes and other aspects in World Diabetic Day to give a good control in diabetes for our patients. So I'm going to introduce my colleagues, Dr. Sandip Ghosh, endocrine diabetes consultant, Dr. Radwan Sawas, eye specialist, and I am Eman, diabetic educator specialist. Hi, Dr. Sandip.
Hello.
I would like to give you questions. So, just like scenario. So, usually newly diagnosed patient when come to the clinic, they will give us some questions. Why I got diabetes? I'm not eating any sugar option, and what type of diabetes I have. So, please can you clear for us in brief what is the meaning of diabetes and what is the common types of diabetes?
Yes. So diabetes is a condition where our body cannot handle sugar very well. That means there is very high level of sugar remaining in the blood, and it can be due to lifestyle or it can be due to a condition called the pancreatic insufficiency, which is type 1 diabetes. So the common types of diabetes are, one is like type 1 diabetes, where we see high blood sugars because the pancreas is not making enough insulin, which is the hormone which drives the sugar from the blood into the cells of the body. And this is usually due to an autoimmune condition, this type 1 diabetes, where insulin secretion is not enough. In type 2 diabetes, whereas we get high blood sugars because there is not enough sugar is not entering the body's cells enough. So the sugars are staying inside the blood, and that leads to high blood sugars, and that can be improved with improved lifestyle. And there is also diabetes which happens to women of childbearing age, during pregnancy, when their blood sugars can go up because they have got risk for developing type 2 diabetes, and also due to the pregnancy that effect can be amplified. So these are the common types of diabetes.
Okay, yes. And also in the same scenario, my patient will come also to ask why I got diabetes. So if you can give us some brief about what is the risk factor to diabetes type 2.
It's a very good question. So risk factors for type 2 diabetes, as I said to you, the lifestyle factors are very, very important. Also, to be more specific, risk factors like not doing enough exercise, making the wrong food choices put people at particular risk. Also, some people would be at a much higher risk because of their family history. So there's a genetic risk as well. So it's diet, physical activity, and the family history. These all sum up the risk for having type 2 diabetes.
Okay.
Carrying on from what I have said, I think people would also like to know about how to prevent diabetes. So people who are at high risk of developing diabetes, what would be your advice to them?
Yeah, this is a very good chance for our customer who are coming with pre-diabetes or insulin resistance, so we can help them in how to avoid diabetes in future or delay diabetes. So we should find what is the risk factor first. If they have overweight, we need to work on weight reduction. If they have blood pressure or cholesterol, we need to keep under control all the time. So if you are looking for weight reduction, we are advising them for healthy lifestyle. So healthy lifestyle here means they need to take care of their food, healthy and balanced diet. They need to do proper exercise. They need to stop smoking or alcohol. They need to improve their fluid intake, improve the stress.
Okay, so that's for people who don't have diabetes. But for people who have developed diabetes, what would be your advice to prevent long-term complications?
Yeah, here also for diabetic patient, they can also avoid complication if they are really taking care of their diabetes. So in this situation, we teach them about medication. They need to take their medication in time and same doses what prescribed by their doctor. They need to follow a healthy lifestyle. They need to keep monitoring their sugar. This gives us very well control in diabetes. Diabetic follow-up, regular follow-up with their doctor. Diabetic screening also, they need to maintain their HbA1c every 3 months, lipid function, kidney function, thyroid yearly if they don't have problem in this. Also eye screening, very important, we advise them to do that.
So I think now we want to discuss with Dr. Radwan.
Eman, thank you for your advices to patients. But now if patient has diabetes and he is taking his medications and doing the lifestyle changes, but can you tell us what is the importance of monitoring his blood sugar?
Yeah, actually this monitoring sugar at home, this is a very important tool, can help in good control in diabetes. So there is a lot of advantage under this. So patient can control his sugar in target all the time between 80 to 180. If the sugar going high through the monitoring, they can take it to normal. If the sugar go low, they can take it to normal. By this way, they are maintaining in target all the time. Additional to that, we can modify or titrate their medication according to the blood sugar. And on this blood sugar also can help us in good control in HbA1c after 3 months, and by this way can delay the complication.
So in this digital life development in nowadays, what is the technologies available that the patient can do better monitoring and checking his blood sugar?
There is a lot of technology available, and specifically I will mention what's available in Zulekha Hospital. A lot of glucometers is available. Additional to that, Freestyle Libra. Freestyle Libra 2, this is like a patch we are connecting to the upper arm, can be read sugar every minute over 24 hours up to 14 days. And this connected direct with our healthcare team in Zulekha Hospital through application named LibreView. So we can see the reading for patient at the same moment which he is checking at home. By this way can help us to do the titration of the medication and the proper management and matching the target of HbA1c after 3 months.
Great, thank you.
Yeah. I would like to ask you also, Dr.
Welcome.
Radwan. So as usual, our diabetic patient, we are sending them to do diabetic screening. Diabetic screening means that the blood test like HbA1c, lipid profile, kidney function, all this. And additional to that, we are also sending for eye specialist for retina checkup. So I just want your recommendation about eye test.
Okay, diabetes mellitus is a big disease and affecting all the organs of the body, and the eye is the very important organ and can be affected by diabetes. And diabetes mellitus can cause many problems in the eye, from the cataract to glaucoma to diabetic retinopathy to optic neuropathy. So any patient diagnosed with diabetes, whatever the type 1 or type 2 or during pregnancy, when the diagnosis is established, the patient should go for eye screening to check the eye and see what is if there is any complication already happened or the eye is still within normal limits, and then we can do the follow-up.
That's very good. And doctor, also how often we can send patient for eye test? Because usually when we ask a patient, please go to check your eyes, they're thinking it's only for vision. They said, well, I'm seeing well. But the idea is we are going for retina. So how often we can send patient for you?
Actually, for first-time diabetic patient, when he diagnosed, he should be assessed. And then if the eye is within normal, no diabetic retinopathy or any other pathologies, then we should check the eye annually, even if the patient hasn't any complaint from the eyesight. Now, if we see that the patient has some degree of retinopathy, for example, then we should go for deeper investigation to classify the retinopathy, in which step he is, and then we will advise the patient to come for follow-up according to the findings that we will see in the investigations. Now, I just want to attract your attention to pregnancy. Any pregnant woman with diabetes, then we should check the eye more frequently, every 2 or 3 months, especially if she has some diabetic retinopathy changes, because in pregnancy, the diabetic retinopathy might progress faster than normal patients.
That's great. Doctor, also a patient already got a complication. So what's the treatment you can offering for the patient?
After assessing the eye and putting the diagnosis what complication patient has, let's say cataract, then the treatment is surgery. But if patient has diabetic retinopathy, we should classify which step of retinopathy, and we can offer him laser treatment or surgical intervention or Now recently we are injecting some medication, new biochemical treatment for treating the diabetic retinopathy, and there are also medical treatment and some vitamins to support the diabetic retinopathy, and the most important, the follow-up.
I'm really thank you, Dr. Sandip, Ghosh. Thank you, Dr. Radwan.
Thank you.
I hope you get some information in how to manage your diabetes. And from our advice, mainly for people are highly risky for diabetes, they need to follow up and follow our advice related to the how to avoid diabetes in future. People they have diabetes, they need also to do proper follow-up for how to control diabetes to avoid any complication. So thank you for this nice information.
Thank you.
Yes.
Thank you.